Also, now it's the month of April. Hospitals have the new financial years, which has come up. Today is the World Health Day. All of us got trained in community health, healthcare administration, where we focus outside the hospital. And that's been our focus. But when it comes to it, how do hospitals benefit from care services? How do you see Jijivisha uh, uh, helping hospitals actually deliver better care uh, and change and make an impact post COVID with the kind of distress we have seen in the last 3 or 4 years?
So I think, as we mentioned earlier, right, we're talking about patient care systems as a cost factor. So I think hospitals can really work towards improving patient care. Look into, say, for example, care assistants to support nurses with basic roles. So then nurses then can focus on critical care nursing skills rather than doing odd jobs that not supposed to be done. I mean, of course, I know that when there is no staff available, then maybe nurses can take over, but you can't have healthcare systems take over nurses' roles. This is something that we look at in UK as well. Basically the idea at the end of the day is to try and look at saving money and redirecting medical teams to focus on treatment and cure and management. But then, while patient support teams then actually manage the assistance of clients in their day-to-day needs, repositioning, nutrition, hydration, personal care, companionship, conversation, because these are things that actually then will encourage the clients to then see, oh, this is wonderful customer service. This is a really good hospital. There are good values here. They're not just looking at my treatment and making money, but they're basically looking at me as an individual. Now, India is slowly becoming a market leader in medical care. I mean, eventually, or whatever, it is going to come to that point where India's global dependence on India for medical care is going to increase. But that strong patient culture is yet to move away from best medical care to best patient care. And this is really a big, big transition that is to happen. So, with the growth of medical tourism, we will need more and more training for greater patient care modalities. So, that's part and parcel of how the system needs to evolve. If the focus is just going to be treatment, then it's not going to have the value, because eventually what's going to happen is the systems itself will say we don't want to go to India, because we don't have that level of support and care. And general notion will come to that point that, we will not get best care. I'll give a small example. I know, we're going to have paucity of time, but I'll give a small example. When I worked during H1N1 pandemic, not the COVID pandemic, this was much, much before 2009. I remember the British High Commission had gone and evaluated, and even the American High Commission had gone and evaluated isolation facilities in India. And I still remember because one of the British High Commission persons from Mumbai had come to Goa to evaluate our facilities. And then they were not happy, because we didn't have good care facilities. They had then put it on their website that, please don't travel to India because during this period of time, because you will be kept in these kind of facilities with not proper systems and everything. So it is that kind of thing, because once they then advertise that, people of those countries will basically look at it. I mean, we have so many issues around, just our malaria incidence is so high. You have so many Scandinavian country people who don't travel to India. So these are all issues that actually are things that we need to kind of work on, because that also impairs and hurts the economy. Especially in the hospital sector, that's basically the bread and butter that's going to come from hospitals becoming just an Indian-centric organization to becoming global organization. So I think that's something that needs to kind of come into play. The customer service component of view should also come to a purview of healthcare sector. It's not that it's not from dominant systems, but it's a general thing for services.
No, that's very good. I think that's a very good example you have given, and we read about Mayo's team-based medicine and where patient needs come first. I think there's a very different perspective which you have brought about.